fewer hospital beds being used in that time. Joining us now is the director of the Institute, Dr. Chris Murray, and back with us is also Dr. Sanjay Gupta. Dr. Murray, can you just explain the new changes to your model? Because we've had you on before, and you've always pointed out as more information comes in, as more data comes in, the numbers will change. Why the lowering now?
So two key things we've been able to incorporate with all the influx of new data in the United States. First, we found out a lot more about hospital practice. And so what we're seeing is that hospitals, particularly in New York, but elsewhere in the country, are admitting fewer people compared to what the original data suggested. Compared to every death that we see, they're putting fewer people into the ICU, and there's lower ventilator requirements. So that's brought down the sort of shortage estimates quite a bit because of that new data influx. And the other big news is that we're seeing peaks in the epidemic in other places other than China, in Italy, in Spain. In fact, 7 different regions have seen the epidemic peak and come down, and that really informs our models about the impact and the effectiveness of social distancing.
Dr. Murray, just 2 questions. Do you know, why the White House's numbers have been higher than yours? When your model was saying 80,000, this was a while ago, that's when they came out with the 100,000 to 240,000 figure. Do you know why their numbers have been higher? And also, what are yours dependent on in terms of people abiding by stay-at-home orders and social distancing? How long in your modeling is that expected to last for?
So in our models, we are building in the assumption that social distancing is going to stay in place till we hit the sort of threshold when we think the first wave is essentially over. And we use a number, which is 0.3 deaths per million people in the U.S. So basically 60 deaths in the United States in a day would be that threshold. And that should come first week of June. And so we're building in the assumption that social distancing is in place until then. We will start to release, hopefully later this week or by the weekend, what might happen if we take social distancing off before then. And we're pretty confident we'll just see a rebound of the epidemic if that's what was to happen.